And now with the segment is our reporter, Laura Windsor.
Eyelid rejuvenation is a popular cosmetic procedure for men as well as women. It corrects the tired look without changing your appearance and has a quick recovery time. We spoke with Dr. Jennifer Hui at Desert Regional Medical Center in Palm Springs about this procedure.
I think eyelid surgery is one of the single most rejuvenating procedures someone can undergo. And your eyes are the first thing that people look at when they look at you. And when we often get extra skin on our upper eyelids, we seem to look tired or feel tired, or people ask us if we look tired. And I think an eyelid lift does wonders for people, and it's a relatively short outpatient procedure that gives patients a lot of return and a lot of happiness and enjoyment afterwards.
Dr. Hui tells us that there are techniques for both upper and lower eyelids.
Uppers, we all tend to notice them. They're droopy. People have to raise their forehead to see better. But the lowers go a long way for helping people look and feel rejuvenated. We all want to get rid of the bagginess and puffiness under our eyelids, and that often contributes to people looking tired. Sometimes just contouring the fat, subtle removal of skin goes a long way to help people looking refreshed. And in general, uppers and lowers can go a long way to help someone. I have a lot of patients come to see me for tearing, as that is one of my specialties, and they often don't realize at the time that the tearing is from an eyelid problem itself and not from the lacrimal drainage system. People can have misalignment of the eyelids, especially the lower eyelids. With time they can become lax, turn in, turn out, and even a very subtle malposition can lead to a lot of symptoms. But all these issues should be addressed at the same time as the functional or cosmetic eyelid surgery, because you want the maximal outcome for the patient with the minimal downtime. And oftentimes people do come to me for a tearing problem, not realizing that perhaps the tearing is also a result of previous eyelid surgeries they've had. Sometimes there's just some excessive scar tissue formation that causes a malposition of the eyelids. Surgeries just don't always go as planned. So there are a lot of subtleties to consider when people come in with tearing. You can't just eliminate a problem within the tear drainage system itself. You need to really thoroughly look at the eyelids and make sure that everything is addressed and the underlying causes are found.
Dr. Hui talks about the recovery time.
A proper eyelid lift should take about an hour. Most of my patients don't require any analgesics following, or perhaps simply Tylenol or maybe Motrin. I usually advise patients that the worst of the bruising and the swelling, I would give myself 2 weeks to recover. I wouldn't plan any important social functions such as a wedding or important photos for about 1 month. But usually I ask patients to take 1 week off of work, just simply because they'll be busy doing ice for the first 2 to 3 days. Ice helps the most with bruising and swelling and increases the resolution of such things. But really, I think 2 weeks is a reasonable amount of downtime before people feel comfortable going out in public. I'd like them to walk away, and when the recovery's done in a few months, to have their friends and family ask, you look so rested. What have you done recently? Did you go on a vacation? Have you changed your diet? What have you changed in your life? And those are the usual stories that I hear that makes patients very happy. They don't want to look done or surprised. And most of all, they just don't want people to know something happened. They just want people to know that they look refreshed. I really do enjoy eyelid surgery. It brings people a lot of happiness on top of providing functional improvement in their quality of life. I have a lot of patients tell me, I've never seen so many bright colors. I just didn't realize over time how little light I was getting in. The world just seems more open. I have had patients who have come to me having hit things changing lanes, or just not seeing cars coming when they're changing lanes because of the extra skin that's hanging over their eyelashes. And afterwards they realize, gosh, I didn't realize how unsafe my driving had become. Other things like the tennis, when people play tennis and golf, they can see the high balls more easily. They're not missing things. I have also had patients come in saying they hit cupboards in their kitchen just because they just don't see them open. But there are a lot of functional indications, but most people by and large are just very happy. 1, because they look very rested, it looks natural, and 2, because they function better.
Eyelid surgery not only rejuvenates your appearance, but also improves your vision, and that is definitely an added bonus. For the American Health Journal, I'm Laura Windsor.